My name is Alice Jones, and my peers and I have put together a presentation for you today about female genital cutting. This is a terrible practice that occurs in many parts of the Middle East and Africa, and really all throughout the world. It is also referred to as female genital mutilation, or FGM for short. This process involves the partial or total removal of the external female organs. This is often done in very remote areas, and so it is not in a medical setting, and it is often extremely painful because it is done without analgesics or anesthesia, and it is also often done with whatever is laying around. So it can be done with broken glass, kitchen knives, scissors, often without any sort of sterilization. This can lead to many complications such as infections, bleeding out, hemorrhage, UTIs, and it can also cause some severe mental complications, psychological, such as depression and PTSD in some cases. FGM has absolutely no medical necessity. It is done because of cultural or traditional reasons. So these girls are enduring these terrible things without any need. Next, we're going to show you some graphic images. So if you're a little bit queasy, you can skip ahead a little bit. So these are images of actual FGM. Here in the top we have images of the different kinds. So you can see that in some cases there is only some cutting or removing of the organs, and then in other cases, such as here, we have actual stitching of the organs so that there's only a small hole that remains for urination. Here in the bottom you can see the environment that these procedures are performed under, and you can see that the girls are often very, very young when they undergo this procedure, and it is often done in groups so that the same tools are used for many different girls. So this can spread infection and disease and is a terrible medical practice. FGM is performed throughout the world, but it is very, very common in Africa. And so you can see here that in different areas there are different rates of FGM occurrence. And in the red, this is where these are the countries in which 80% or more of girls undergo the procedure. And there are some areas where the procedure is not common at all. So this has to do with the culture and tradition of the areas, which we will talk about next.
Hi, my name is Jess Olenek, and I was working with Alice along with some of the other girls that you will get to meet about this presentation. So I'd like to talk to you about the history and culture and reasons why this is happening. So of course I'm not going to be able to mention all of the reasons because there's a plethora of them, but the main ones I'm going to discuss are the sexual reasons, the cultural reasons, and the social reasons. So this is often an initiation ceremony for these young females. So it'll occur when they're younger, around 7 to 9 or early adolescence. And it's common, like I said, to undergo as an initiation process. So there'll be multiple females being mutilated at once. So the procedure is often performed by someone who is respectable in society or by someone who is a higher family member, perhaps a grandmother or even the child's mother, perhaps. So often it is an initiation ceremony for these women to be initiated into womanhood. Now, once they're initiated into womanhood, it makes them marriageable and more appealing to men in their society, and thus can even make them financially stable. So economically, it is an advantage in some cultures. Also, these women can be seen as impure in the eyes of God or whatever their religious faith is, so therefore removing the clitoris or certain female genitalia might be necessary to make them more pure. It is also, there are common myths, such as that the clitoris or something could grow or extend to become more like male genitalia, so it could be removed for reasons and myths like that. Also, there is, like I said, a social standpoint. So these women, if they do not undergo this procedure, oftentimes in society they could be shunned or banned from their society and have to move elsewhere unless they get this procedure done. If they do get the procedure done, they're able to come back and live with their family and adjust to their society, but without it, sometimes these women have no other hope.
Hi, my name is Shay, and I'll be sharing with you today a story from a survivor of female genital mutilation. So Aisha is from Gambia, Africa, where she became a victim of FGM at 6 years old. Her mother dropped her off at the village doctor's house, where she was held down immediately by 3 women. Another woman did the procedure with a dirty knife covered with other girls' blood and no anesthesia. Aisha was then left to bleed into a bloody hole for 3 months to heal, along with some of the other girls that underwent the procedure with her. So if you would like to stop this horrendous procedure from being done, please visit www.unfpa.org/female-genital-mutilation to get involved. Thank you.